Welcome to Season 7 of the Institute's Child Welfare Podcast, where we delve into the efforts of child welfare leaders as they explore innovative strategies to support system-impacted parents and caregivers. You'll hear about how these individuals have navigated through challenges, celebrated triumphs, and uncovered invaluable lessons along the way. Today, we're joined by Elizabeth Curley, a doctoral candidate at the Florida State University College of Social Work. Their research interests include strategies to improve and maintain human relationships during and after incarceration, especially concerning prison visitation. Their interest in criminal justice issues blossomed while working with individuals who were court-mandated to complete substance use treatment. Before entering the doctoral program, Elizabeth embraced their passion and worked for an agency that conducted a prison visitation program that promoted quality bonding between children and their loved ones in correctional facilities across the state. Elizabeth has worked as a research assistant for the Institute for Justice Research and Development, otherwise known as IJRD, assisting on numerous projects on topics across the spectrum of criminal justice research. Thank you so much for being here today.
Glad to be here.
So, Elizabeth, I'm excited to welcome you today as a fellow Florida State University College of Social Work alum. You've been with the college since you were an undergraduate student, so I'm curious what led to your current position as a doctoral candidate focusing on the criminal justice system.
Thank you so much for having me, and what a great question. If someone were to look at my CV resume, it looks very intentional where I ended up, but looking back, it definitely feels more like I just followed a thread that took me to where I ended up being. So I started out working with clients who were court-mandated to substance use treatment because they had open child welfare cases. That wasn't my original interest in child welfare. It just was happenstance that those were the people I ended up working with. And when I was in Hillsborough County, the child protective investigators in that county are actually sheriff's deputies. So through that, I ended up working with the criminal legal system by proxy. So I was going to dependency court hearings where I was seeing what the actual court proceedings looked like. I was going to case staffings at the Hillsborough County Sheriff's Office, and I was seeing some of the limitations of court-mandated treatment. So through all those experiences, I was like, man, I really think the criminal legal sphere might be more my interest. So when I got into my master's program, I knew it was going to go really quickly. I was really intentional about saying yes to every single opportunity that was offered to me, whether or not I thought it was going to be a good fit for me. So I got an offer to participate in criminal justice research with Dr. Tripodi in his criminal justice class. And I did interviews at a couple prisons. One of them, I was at Lowell Correctional in Ocala, and I just absolutely fell in love with the work. So when I had the opportunity to be placed for my master's internship, I was like, give me the most obscure option that you have, because I know I can do substance use treatment if that's where I end up going, but this is my last chance to really learn. I got a call from the liaison who was like, well, we have this place called Children of Inmates. First time ever sending an intern there. You want niche? That's definitely niche. So I was brave enough at that point to take a new opportunity like that. So I worked with Children of Inmates for my master's internship down in Central Florida, and then eventually came on as a full-time staff. So I was covering 5 counties across Central Florida, 744 clients, give or take, with a couple other team members. And as a fresh new social worker, that was intimidating, but we got to take children to see their incarcerated parents, grandparents, and step-parents. And there are very few social work positions where you are making life-changing efforts, and I think a lot of us spend time just trying to move people one rung up a ladder, but we were able to, in a single day, see people's lives change. So the average amount of time people had spent without seeing their loved one who was incarcerated at the time of enrollment was about 6 to 8 years. So I was in the room, first time a family had seen each other for 6 years, and you really just don't forget that kind of work. So I knew I wanted to get a PhD. I absolutely love research, so I was really encouraged to put in an application, and I had moved my timeline up because it had gotten really competitive once IJRD, the Institute for Justice Research and Development, had been placed at the College of Social Work. So I moved my timeline up, submitted my application, had a lot of faculty members who were incredibly supportive during that time, and once I got there, the doors just kind of opened.
Fantastic. And now you've developed a new intervention, the Inclusive Nurturing Through Elevating Relationship, or INTER program. So first, what is INTER? And second, how did you arrive at this for the focus of your dissertation?
Thank you for asking. INTER is a 8-week manualized program to strengthen the relationship between incarcerated parents and the caregivers of their children. It is also a synchronous role-specific group program. What that means more simply is that there's going to be one program group that's happening in the jail with the parents who are incarcerated, and there's going to be one in the community for the caregivers who are non-incarcerated. Those will be happening at the same time, same programming materials, and it will continue for the same amount of time for both groups. But when they get their classes done, every week they will be asked to do an activity or like a homework assignment with the other person in the study. So they'll be meeting once a week with that other person to complete the materials, and they'll go back to their role-specific groups to discuss that. One of the advantages of that is that once they go back to their role-specific groups, it'll be caregivers with caregivers. So if they want to talk about frustrations they had while they were completing their activities, they have people who are in a similar situation that they can discuss that with without increasing the tensions in that relationship with a mixed group. The way that I developed this program, it originally started in my intervention research class in spring of 2021 with Dr. Pettis. And at that point, I had never had any experience with intervention research except for some mild peripheral experiences in the doc program. And I had been fortunate. I had been on 8 research projects with IGRD at that point, so I'd seen a lot of different methodologies. I'd seen a lot of different approaches to research, but I didn't think I was interested in implementation science or intervention research at that time. And originally, I was looking at digital communication for visitation. That was really my area at the time. And I had started the assignments working on, I think it was a school-based program for children with incarcerated parents. 4 weeks in or so, it just fell on its face. And I remember Dr. Pettis being like, I don't think this is going to work. Maybe we find something else. So I started completely over. And that was really frustrating as a doc student. As I'm sure you can imagine, starting over 4 weeks of assignments behind can put a lot of pressure, but I think that's exactly what I needed. So when all that pressure was on, I was like, I need something that's really going to work. I knew there was this giant gap in the literature where children with incarcerated parents, most of them are absorbed custody-wise, at least informally, through kinship caregiving. Usually maternal grandmother is the one who's taking care of the child, but not always. And programs just didn't include them. There's one program that's been modified to include caregivers, but it wasn't originally designed that way. I just didn't know what to do with that. So I started honing that down, and eventually, through a very hectic semester, the manual was mostly done. And all of a sudden, I realized that my clinical heart really, really enjoyed intervention research. So it started then, but it's been 3 years of modifications and revisions and strengthening since that point.
Excellent. So I know that getting a project like this off the ground can be incredibly challenging. In addition to some of the child welfare specific challenges we face in research, you're also working with a federally protected class of research participant, which is incarcerated individuals. So can you tell us a little bit more about the process of getting to the point where the pilot is now a reality?
Absolutely. So as you mentioned, there are a lot of limitations or restrictions around working with vulnerable populations in the research arena, child welfare especially. I think one of the advantages of my program is that I don't have children included in the programming. So since it's just the co-parents or the caregiver and the incarcerated parent, we don't have to worry about any approvals for the children being part of the research. So that allowed me to focus on the people who are incarcerated in that vulnerable status during my application to the university for the study. I have been incredibly privileged to not face some of the typical barriers that researchers face for criminal justice specifically. I've worked with incredible faculty members who have networks and experience well beyond what I've experienced, and so they made sure that I knew what I was going into with this project. So I have not faced a lot of difficulty getting into correctional facilities, although that is a common barrier. With the application to the university, there is always a consideration when it comes to the vulnerable population that you have to pivot every single perspective 100 times to make sure you're not missing anything that could put someone at harm. One of the features we have in this programming is that we are screening for abuse dynamics during the enrollment of participants to make sure, even if it's digital communication they're visiting with to do the activities, we're not putting anyone in harm's way by encouraging that relationship. We also have made sure that there's a free visitation option so that there's no financial burden incurred by the programming. So a lot of those ethical considerations were not necessarily barriers, but they did take time. So a lot of that revision was just making sure, did we miss anything? One of the barriers we are facing is just the time it takes to get this project moving when the goals of a researcher, whose main focus is getting the research done, doesn't necessarily align with a whole institution that is trying to maintain themselves on a daily basis. So the jail has different considerations than the prisons that I've worked with in the previous studies that I've been on. So originally this program was designed for prison, especially because programming is a lot more stable in the prison structure because people are going to be there for a little bit longer than what a typical jail stay looks like. We did reduce down the original time of the program from 16 weeks to 8 weeks to fit into the jail's programming requirements. But at the same time, they've been changing visitation protocol for their own reasons, and we have had to kind of consistently work with the study site to make sure that we're meeting their expectations and they're meeting ours. It has been a wonderful process, but there are definitely time investments that have to be made in making sure that everything goes as smoothly as it can.
Absolutely, and I can definitely appreciate that. Dr. Melissa Rady and I have talked a lot about it. Feels like a giant logic puzzle sometimes when you're trying to do this type of community engaged work. So I appreciate you putting in the effort that goes into all of that. So I know that I'm eagerly awaiting your final report at the end of 2024, but do you have any preliminary findings that you're able to share?
Absolutely. We're still in the enrollment process right now, so we don't have any data that's solidified right now, but there are a couple interesting things that I'm starting to see through interviews with the participants because I am doing data collection myself as well. One of the things that we see in research around co-parenting during incarceration is who is taking care of the children is almost always the maternal grandmother, and we're not necessarily seeing that in this population. We're seeing that a lot of the people who have legal custody are the initial biological parents of the children, but that grandparent on either side is an interim caregiver in the way that they gatekeep contact between the co-parents. So that gatekeeping piece shows up in the literature a lot, that incarcerated parents and their co-parents will report that the person who's taking care of the kids is the gatekeeper of contact between the child and the incarcerated parent, and there are some stressors that build from that. But what we're seeing is that a lot of participants who are incarcerated are reporting that their parent is being the gatekeeper of contact between the co-parents so that if their relationship is not healthy enough to talk to each other without conflict, that the mother or father of the incarcerated participant is kind of fielding those contacts and passing along messages to make sure that that relationship can stay as healthy as it can for the child, even if the co-parents are not speaking directly to each other. So that's been particularly interesting. We're also seeing that about a third of the participants have ever been involved with child welfare, which aligns with what we see in the research, but we don't have great numbers on jail. So I'm really excited to be able to solidify, at least for our sample, what the rates of previous and current child welfare involvement are. Right now, I believe we have about 15 people who are incarcerated, and then we've got 4 non-incarcerated caregivers who are enrolled at this time, and none of them currently have any child welfare, but about a third of them have had previous child welfare, sometimes from children from other partnerships, not necessarily the incarcerated partner as well.
So you mentioned that there are about a third of folks in your sample that have some interaction with the child welfare system previously, although not currently. How do you see Inter being part of a larger prevention strategy?
So I've thought a lot about the intersections between this population and the child welfare system because the research says that children of incarcerated parents don't often end up in the foster care system, and if they do, it's often not necessarily related to the parent's incarceration. So the children are placed in foster care before the parent becomes incarcerated, and the incarceration is just an incidental within that system of factors. Sometimes it feels like maybe this program doesn't support the structures that it appears to, but I think Inter's biggest advantage is that preventative piece, like you were saying, that if we can encourage these families that we know are at high risk based on incarceration, even prior to incarceration, we know there are risks in those families. If we can encourage them to strengthen within themselves and empower them to have healthy relationships and co-parenting, then we can prevent that entrance to the system at all. There are also, I think, added benefits to what we're learning through this programming. A lot of parenting skills courses, research shows, focus so much on deficits in parenting skills that it disempowers the people who are involved. Inter, at its face, is not a parenting skills program. We do talk a little bit about child development and what to expect when incarceration is present, but we're really focusing on that strengths-based, healthy relationships angle. I think by not including the children and keeping the involvement with the children in a research or programming piece as minimal as possible, we can allow those families to strengthen within the systems they already have and empower them instead of potentially creating further risk for these families through our intervention processes. One of the interesting things that we're seeing that I didn't expect as a researcher is that we have a measure on co-parenting health we're sending out and we're asking everybody, and there's a question about financial burden of parenting in the parenting health or parenting stress measure. And I think if you asked general civilians, other researchers in family services, or clinicians, I think the obvious answer is that when we're dealing with people who are in low-income situations, that of course parenting is a burden financially. None of the participants are reporting any amount of burden financially. I think that the circumstances of incarceration lend these families to not only intergenerational care of the child, but really that it takes a village mentality. And the parenting reward is so high that even some of the stressors that people who are in secure financial situations would report. I mean, I know my parents would say, absolutely, it was a financial burden. It's expensive to raise a child. These families aren't necessarily having the perspective that people might expect. And so I think since it is so broad and is so focused on families of any collaborative system at any point in the incarceration and is so neutral as far as the cultural expectations in the programming, that we're going to see a lot of things that maybe we haven't seen before from our predisposed beliefs about what these families should look like. So I'm really excited to see new preventative strategies that we can find through what we're learning, even if the program itself doesn't seem to be preventative in nature.
It's so interesting that you say that, because so much of what we're learning about prevention, right, particularly when we start to untangle poverty and neglect, a lot of the conversation is around things that you're talking about: concrete economic supports, social supports, right? We see that in a number of projects that I've been talking to as a part of this season of the podcast, but also just in a number of the Institute's conversations with our partners in Florida. So I think that's very interesting that you're starting to uncover some new patterns within these nuanced groups of folks, and appreciate the strengths-based perspective that the program is taking in identifying where these strengths lie in individual families. So I'd like to end our conversation by asking you, what is the most important thing that we can do to support the co-parenting or co-caregiving relationship between an incarcerated caregiver and their non-incarcerated co-caregiver?
So I don't know if there's one specific thing, but based on the research that I've been seeing, one that can make a huge difference is knowing that if children witness the arrest of their parent, that there is going to be higher emotionality in that child. As we know, these families are at risk, but may not be engaged in child welfare services the way that we would expect them to. So if we can arm child welfare workers with just the knowledge of those intersections and the things to look for smaller strategies, everybody agrees that the child welfare system and the workers within it are very overworked, very burdened by a lot of the expectations, like high caseloads. So I don't know that it's realistic to say, like, make sure you know about make sure that we're referring out to these major systems, like be involved in what correctional summits are doing. I don't know if that's feasible for the average worker. But if it's something as simple as knowing, if a child has witnessed their parent's arrest, regardless of why they're involved with us, maybe we can refer to smaller services just to create more strength in that family. I think that makes a big difference long term. I also think being aware that the way that the general public views incarceration is not necessarily how any of the families that are going through it view it is very important in making sure that these families are empowered. All of these families have found a maintenance and a status quo that makes sense for them. And if workers go in expecting that children are going to do poorly, then the children are going to do poorly because no one's expecting anything different. But if you listen to the way these families talk about how they've developed very intricate and complex systems to make sure everyone is thriving as best they can, build from within that, strengthen what's already there, and understand that If the interim caregiver doesn't talk to the parent that's incarcerated, maybe there's a reason for that. Obviously, there are always ways to intervene if there are benefits to that intervention. But I think a lot of times our intervention creates additional risks that may not be necessary. The final piece that I could say is that about 4% of children in America are experiencing a parent who is incarcerated. So that means they're going to show up not only in the child welfare system from various points, but in services generally. So if we're not looking for the situations that we know exist, and we're not normalizing the expectation of incarceration when we know that about 47% of Americans have a close family member who is incarcerated or has been incarcerated, if we know that almost half of Americans have a close family member who's incarcerated, and we know about 4% of children have a parent who's incarcerated, then these are really common experiences, but for some reason, they're not necessarily being considered at all points in our clinical interventions and our system of care. And if we could just be more aware of the realistic risk that these families face and that they have their own systems, we have supports. If we can listen to what they say they need and then maybe add some additional points of view that we can offer through our clinical experience, then great. But I think that also takes having some level of knowledge of what intervention can look like and what the strengths actually are. Because if we go in unfamiliar with incarceration generally, there is a large risk that we're adding into that conversation that we may not know what we're talking about. And so just being familiar overall with incarceration and some of the nuances, especially since that's a state by state, even sometimes county by county difference when it comes to the experiences of incarceration, expecting clinicians to have at least some baseline knowledge of what incarceration looks like and what that can mean for families would make a really large difference in how these families are being provided services.
Well, and I love how you talk about sort of those small, tangible things that people can do. And as you alluded to, we know the child welfare workforce is very burdened in their day-to-day work. So we're not necessarily asking them, hey, go implement Inter. But, hey, have the awareness that if you're interacting with a child on your caseload who, like you said, has had a parent who has been removed, knowing whether or not they were present for the arrest can make a difference. But I can also imagine that that type of knowledge makes a difference for teachers, right, when they're engaging with students in their classrooms, or law enforcement officers who might be interacting with parents, particularly in situations where, you know, they've decided an arrest needs to be made. And so I think having these little tidbits of information in mind can support children and families, like you said, across systems and not just within child welfare. So I appreciate that perspective.
And I think it's important to note that the state of the current literature around parental incarceration, we can't really say that incarceration is the reason these children do more poorly when it comes to educational attainment, their emotional stability, and just long-term health outcomes in general, because we don't have the causal nature of that. It's not really ethical to do a study and say, okay, you're going to become incarcerated just so we can see if your children do worse. So we can say it's a causal risk marker, which means we know if incarceration is present, then other risks are present. A lot of our intervention is just acknowledging that when incarceration is present, these families are not necessarily thriving. And so there are a lot of different realms that we can intervene on to increase the level of support. Transportation is a very large piece of that puzzle. And that's a lot of what children of inmates did, and a lot of why our work was so successful. We weren't providing a ton of psychoeducation. Like, we were obviously providing materials and teaching when we could, but the bonding visits themselves were just, we rented a charter bus. We're going to the facility and you don't have to pay for that. And we had the support to be able to do affidavits where if a parent had lost their, quote, privilege to visit, we could be the legal guardian for that day, kind of the way that field trips do, where they could sign over, okay, the children of inmates staff can take my child to this facility. And so the children could still do that visit, even if the parent didn't have the ability to get into that facility. So smaller pieces like that, just greasing the wheels, so to speak, for what these families already know about the system. Because I would argue at the end of the day, no matter how many prisons I go into, my perspective is always going to be limited by the role that I'm in and what those facilities show me as a researcher. The families who are the ones driving cross-state to get into these facilities, going through security when there aren't people in blazers around escorting them, it looks a lot different. And so if we can just trust them and what they've experienced, then our services can work within the system they already know exists, instead of coming in and saying, no, that system doesn't exist and here's how we're going to do it instead. So I think there's a give and take, not only through information, but just through trust with these populations.
We know for families impacted by the child welfare system that there can be a number of different dynamics in terms of custody. There can be foster parents and relative caregivers and informal caregivers. And I'm curious what that looks like in your research and in the context of Inter.
So within the project right now, we're seeing a lot of retained custody of the original biological parents for the children that are in the household. We are also seeing that the parents who are incarcerated don't have a good grasp on what custody means for their children. And this is something that was very prevalent at children of inmates. One of, I think, the larger risk factors for this population is that if you become incarcerated in a prison setting, no one sits you down and says, hey, you can have your parental rights terminated by the fact you are incarcerated. That is one of the reasons that termination of parental rights can occur. They don't say, hey, although you're here, you still retain custody of this child and you have to file these legal forms to make sure that temporary custody's been given. And so what ends up happening is at the time of arrest, the family member gets taken away, they go to jail. Things are incredibly chaotic during the arrest, the initial incarceration, and especially during court cases and transfers to longer sentences. So what ends up happening is you have families that absorb physical custody of the child, where grandma lives down the road, takes in the child the day of the arrest, and is just kind of playing it by ear. And no one necessarily knows that there are additional processes that have to be taken care of for everyone to be on the up and up, quote, quote, for what legal custody documentation looks like. What I have seen happen in cases when I was working with children of inmates, it took one interested healthcare worker or one interested school worker who happened to know about the requirements of custody to ask, hey, where is your custody document for this child when grandma comes in? And then all of a sudden you have these families that are involved with different systems because grandma never knew that just having the child in the home was not a formal custody agreement. So I think one of the opportunities for child welfare workers is knowing that these informal custody arrangements happen, especially during incarceration, and finding ways to assist the families in accessing services to be able to get those custody arrangements set before there are potentially legal ramifications of grandma's trying to do right by taking a child to a healthcare service because, the child's sick, and then all of a sudden you're dealing with issues where, well, you don't have legal custody of this kid. So I think just providing the knowledge and then the access to those resources to do it on their own can be a huge advantage and can help prevent clogging up our different systems with families who want to do well but just maybe don't know what those processes look like.
Thank you again, Elizabeth, for being here and talking to us about Inter. I'm looking forward to the final report.
Thank you so much for having me. It's been a pleasure.
I'd like to thank all of our guests for sharing their knowledge and experiences with us today. If you're interested in learning more about this episode and our guests, please visit our website at www.ficw.fsu.edu. You can also follow the Institute on Facebook, Instagram, Twitter, and LinkedIn at FSU Child Welfare. Thank you to our Director of Communications, Emily Joyce, our producers, David Heller, Brantley Jones, and Alina Bachman, and our audio engineer and editor, Izzy Kring. Finally, thanks to all of you for tuning in today. I'm Dr. Lisa Magruder for the Florida Institute for Child Welfare.